Linda Fabiani.
Thank you. Presiding Officer, there is an important issue that I feel should be raised at the next meeting with NHS Lanarkshire. Is the Minister aware that Kilbryde Hospice opened some time ago to day patients, but despite having inpatient beds, these are not being utilised? This is really frustrating for all the volunteers and local residents who worked to bring this hospice to East Kilbride and Lanarkshire. Will the Minister intervene and raise this matter to bring clarity to this situation and indeed, I hope, provision of hospice inpatient beds in EK and South Lanarkshire?
Minister.
I have been made aware of this situation, and I'm happy to meet the member to discuss it further if she would wish. I think she knows that South Lanarkshire and North Lanarkshire Health and Social Care Partnerships are currently working together to agree how to make best use of local palliative care services and supports to meet the needs of their populations. Earlier this year, NHS Lanarkshire established a short-life working group on how best to do this, and I understand the group will be sharing its recommendations shortly with a view to engaging further with stakeholders in the near future. And following this, proposed way forward will be presented to North and South Lanarkshire Integration Joint Boards, hopefully before the end of this year.
Brian Whittle.
Thank you, Presiding Officer. In 2009-10, NHS Lanarkshire spent £13,000 on agency nurses, but by 2016-17 this had rocketed to over £1.8 million. Over the same period, the number of unfulfilled nursing and midwifery vacancies in Lanarkshire increased from 18 to 254. Does the Cabinet Secretary agree that a major contributing factor was Nicola Sturgeon's decision to slash training places for nurses when she was Health Secretary? And what will the Cabinet Secretary do to rectify this situation and ensure Lanarkshire hospitals are not chronically understaffed?
Minister.
Well, as the member knows, NHS spend is an extremely small part of the overall health budget, and as the member also knows, we are currently working on NHS workforce planning. But perhaps the member, in relation to Linda Fabiani's question, would like to join with me in congratulating nurses in the field of palliative care and recognise the work of the University of Bath and the lead author of a report there who says that Scotland is leading the way with ambitious targets in palliative care and reorganisation, and it's a place to come to in terms of leading in palliative care.
Monica Lennon.
Presiding Officer, can I just say for the record that I wholeheartedly agree with Linda Fabiani, and I know that the Lyons family, who lost a much-loved father and husband, Frank Lyons, an MND campaigner, would really appreciate that being followed up. But I wonder if the Minister is aware that Ward 18, which is a care of the elderly ward at Hairmyres Hospital in East Kilbride, has been closed to new admissions. Is the Minister able to clarify if this has resulted in a reduction in the number of available beds for elderly patients at Hairmyres, and if this measure is a permanent one?
Minister.
I'm happy to investigate the issue that the member raises and write to her further on that. I'm not aware of that particular issue about Ward 18, but as I say, happy to send information.